welcome to Medical Alley's 2021 virtual day at the Capitol. Thank you very much, all of you, for being here. Your time is very much appreciated. We know it's a priority, and again, we appreciate it. My name is Stephan Hobart. I'm the interim president and CEO of the Medical Alley Association. And having been the past chair of the Medical Alley Board of Directors, it's a privilege to be back with this incredible community. This year looks a little different. Rather than meeting inside the Capitol walls, we are connecting virtually from our living rooms. And while our day may look different, the message remains the same. The Medical Alley Association is the central nervous system of the most diverse and influential healthcare community in the world. Our mission is to continue to elevate the Medical Alley region as the global epicenter of health innovation and care. We would not hold that leadership position if it were not for the incredible work happening within this community in every sector of healthcare. The Medical Alley Association represents the leaders and companies who are committed to envisioning the new patient experience, building economic models for value-based care, and redefining the medical supply chain, ultimately transforming the future of healthcare. Today is about the members of the Medical Alley Association who are committed to transforming healthcare and nurturing this precious global epicenter of health innovation and care. The 1,000 plus healthcare companies who employ over 500,000 jobs and have a $60 billion impact on Minnesota's economy. Medical Alley gets discussed in places as far away as Europe, Asia, and Australia. Organizations outside Minnesota want to do business with companies in the region and or move here entirely. And that's a testament to the life-changing work happening in Medical Alley that have benefited millions of individuals all over the world. This is to be celebrated, and it is to be advanced. In Medical Alley, we're not just a collection of companies, competitors, and colleagues. Yes, this community has over 600 members who make up a very diverse ecosystem, an ecosystem where we can learn and challenge each other, where we can have conversations that don't happen anywhere else in the world, and where we can act as a collection of capabilities and talent to tackle the challenges that we face as a community. If you want to see what healthcare will look like tomorrow, come to Medical Alley today. The future of healthcare is unfolding here minute by minute. The status quo has always been, if you want to work in finance, go to Wall Street. If you want to work in politics, go to DC. If you want to work in tech, go to Silicon Valley. However, if you want to use any of those skills to save lives and make a real impact, come to Medical Alley. Medical Alley is a one-stop shop if you want access to the biggest names and ideas in healthcare. Whether it's devices, payment, digital, or biotech, there is no better place in the world where leaders and innovators are working together. What we have seen in the last year is that the pandemic has profoundly changed many aspects of life for the foreseeable future, and perhaps none more than the transformation of healthcare. As a community, Medical Alley has demonstrated the leadership, innovation, and execution worthy of being recognized as the global epicenter of health innovation and care. Despite the uncertainty of these trying times, we continue to lead the transformation of healthcare, and we continue to drive the changes that move us forward and define our emerging healthcare system of tomorrow, making us better prepared for what lies ahead. In the early days of COVID-19, before the global nature of the pandemic was really clear, Medical Alley companies were already preparing to lead, helping stand up facilities all over the world and ramping up production supplies that were mission critical. In short, they led and they continue to lead the world's response to the pandemic. Throughout this pandemic, the Medical Alley Association has brought the voice and expertise of our community when it has been needed most. We have consistently engaged with policymakers, including Minnesota's Governor Tim Walz. We work closely with Minnesota D Commissioner Steve Grove and Minnesota Department of Administration Commissioner Alice Roberts Davis to bring support to the state's efforts to manage the pandemic. We are honored to have both commissioners join us for Medical Alley's Day at the Capitol and share a few remarks. We'll start with Commissioner Grove, a familiar face within the Medical Alley community. As the Commissioner of Minnesota Department of Employment and Economic Development, Steve is focused on growing the state's workforce, closing the opportunity gap, and providing businesses with the help they need to grow, stay, and thrive. Grove has been a strong supporter of Medical Alley's innovative ecosystem, supporting an industry sector that can help create jobs, attract young workers, and put Minnesota on economy's cutting edge. Please join me in welcoming Minnesota Deed Commissioner Steve Grove. And just a practical remark real quick, the chat and the Q&A is open, and Lily and Bobby are monitoring. So as you have questions, please enter them, and we'll make sure to use those during the Q&A. Commissioner Grove, over to you. Thank you.
Great. Thank you, Stephan. Good morning, everyone. And Stephan, congratulations and thank you on taking the helm of Medical Alley at a critical window in our state's and our country's history. Of course, we're sad to see Shay go and thrilled for his next chapter, and really excited to see you come in and take the helm of this organization. I see lots of other familiar faces on the call this morning. Proud to see Launch Minnesota board member Joni Hubler here, and Bobby Patrick as well, who we work with, I feel like, almost every week. And of course, my colleague, Alice Roberts-Davis, who we'll hear from in a moment. This is a treasure of Minnesota's economy, Medical Alley. There's just no other way to put it. Stephan really, I think, defined it well. It has been a driving force in making our state and our medical technology and medical sector more broadly really the envy of the country and of the world. And it was great to see that even though the pandemic gave us so many challenges over the last year, Medical Alley still had a record-breaking year. Almost $1.5 billion in venture capital investments, a whole host of new company starts and growth. And as we'll hear from Commissioner Roberts-Davis in a moment, this industry stepped up when Minnesota needed it most. And I think when you go back and see the history books of how Minnesota responded to COVID-19, Medical Alley will be right in the center of that story for all that you did to help our state. So thank you for that. Thank you for your support and guidance and advice and leadership to us in government. We indeed really want to be partners with business and with industry to make this the best state possible to build, grow, expand companies. And it's particularly companies with innovative jobs that pay well and they create a whole cluster of economic activity around them, which is exactly what Medical Alley companies do. I thought I'd offer just a couple of remarks, and I'm really curious to hear questions from you all. Of course, I wish we were all in person at the Capitol doing this, but soon enough we will be. Things are looking brighter, but it has been a tough year, and we are coming up on a one-year anniversary of the COVID-19 virus. Coming into our state in that year, we've lost about 385,000 jobs. Right now, we got about 313,000 Minnesotans collecting weekly unemployment insurance benefits. That's more than 6 times the rate that we usually do at this time of year. So we are not out of the woods by any stretch. We have paid out about $10.8 billion in unemployment insurance benefits from our department throughout this year, and that number climbs every day. And so we have got to work very hard to come out of this pandemic, not only from a health perspective, but from an economic perspective as well. And I know we can count on Medical Alley as a key partner and driver in that effort. One of the aspects of this pandemic that has been so abundantly clear is that it has a very uneven effect on our state's economy. There are certain industries that have been really hollowed out, like hospitality, like arts and entertainment, just given the nature of how this virus spreads. And there are certain industries that have done better. Medical Alley has had some success, of course, as I mentioned a minute ago, but there's certainly businesses and industry types within Medical Alley that have had their challenges as well. We've seen job losses of over 8% in direct health and medical insurance carriers over the last year. We've seen direct care providers lose jobs at around 3 to 5%. On the other hand, you've got medical manufacturers and pharmaceutical companies that are doing quite well and have seen job growth in the 1 or 2% range. So again, it is a sort of an uneven pandemic in that sense. And of course, uneven on workers too. We know that workers who make lower wages are by far the most likely to be on long-term unemployment right now. And people of color far and away have faced a steeper challenge, not only from a health perspective, but from an economic perspective too. If you are a Black Minnesotan in our labor force today, there's a 67% chance that you have applied for unemployment insurance and received at least 1 week of payments over the last year. And if you make under $15 an hour, you're by far the most likely to be on long-term state assistance as well. So in this next chapter of the Minnesota economy, which we are writing as we speak, we have got to create more jobs. And one of our main theses in this is just based on the data, based on the history of how job creation happens during downturns. And one of the most tried and true ways that new job creation happens is through small business growth and through startup growth. And in part, that's because in downturns, you see more people try new things. There's either disruptions in the market based on crisis events and people see a gap to try something new, or frankly, they're kind of on the ropes and don't have another option for employment. And so they try something new. We've seen that true in Minnesota just in the past 4 or 5 months, 40% higher start rate of new businesses than you would usually see in a given year. So that is already increasing. And one of the things that we want to do at Deed is make sure that every single business that starts has the best chance possible to succeed, and that more people take that leap and start something new. And so we are thrilled to be partnering with Medical Alley on that effort. We know that our medtech and healthcare sectors are going to be a major source of that growth. We think it's a true competitive advantage for our state. And as you begin to see, people leaving Silicon Valley, something I did a couple of years ago myself with my family, leaving the East Coast as well and looking for other pockets of the country to live in, especially in this virtual working world, we have an opportunity to really capitalize on, talent outflows from the coasts and an increased focus on Minnesota as a location to build and grow a great company. So this session, we're pushing priorities that will get us there. Of course, our angel tax credit, something that's very important for Minnesota companies, and the Medical Alley has been a long champion of, has helped us craft and shape over the years. We want to get as much into that tax credit program as we possibly can. It is vital not only to help increase investments from venture capital in Minnesota companies within the state, but traditionally over half of that money comes from investors outside of Minnesota. So it really shines a spotlight on our startup ecosystem for investors from outside the state who might not otherwise look here if there wasn't a tax benefit or a slight incentive to kind of tilt your eyes towards Minnesota. And it's just a huge tool that we need to leverage to highlight our state. And then there's Launch Minnesota, which I mentioned a moment ago. Jody and others have helped us build a really powerful, we think, network across the state for educating entrepreneurs, giving them kind of that early support and education they need to build and grow companies, to kind of decrease the risk factors in starting a new business, to try to increase the number of folks that start businesses. This is critical to help build the future of our state startup ecosystem, and not just in the Twin Cities. That's been kind of the core thesis of Launch Minnesota, is that you can start a company from anywhere in the state. So we are doubling down there. We want to keep expanding that program. We ask for your continued support to advocate for that at the legislature. And I think as you see Medical Alley starts begin, which we're so thrilled to see happen, and to partner with Launch Minnesota on, we think this is just all part of this story of Minnesota on the rise. And maybe I'll just end by saying that in recessions, there are states that come out better and states that come out worse. And none of that is inevitable. It takes a lot of hard work, and it takes industry and government working together. It takes a thesis about where you're headed. And it takes really a sort of aggressive and assertive attitude to really go out there and say, hey, Minnesota is a place that's going to adapt. We're going to learn from our mistakes. We're going to grow. We're going to become a great state to build a business. So it has been a challenging year for sure. It has been an incredibly challenging year for our medical sector as well. Minnesota, we think, has risen to the challenge and has learned a lot from our last year. And we think that this next chapter of our economy is going to be even better if business and government can work together. So thrilled to be here this morning. Thanks again for having me, and eager to hear your questions and thoughts and feedback.
Great. Great to hear your priorities. And as you mentioned, the whole Medical Alley starts, Launch Minnesota, it all comes together around the early stage. And that's a conversation we've had over quite a period of time. So I really appreciate hearing that. And let me maybe open sort of the questions with a question on go right at it in a sense on the angel tax credit. Two questions, I'll fold it into one. One is, of course, what do you think for opportunities for fully funding it this year? What does it look like? Another question that sort of comes with that is, it was funded in 2019 and it will be hopefully funded in 2021. It wasn't funded in 2020. Have you already seen impact of that non-funding year? Is it that immediate?
That's a great question, Stephan. And yes, we did. There was clearly pent up demand for the credit. When we opened it up again this year, it has just gotten gobbled up. I mean, we are seeing hit rates as fast as we've ever seen in just the first couple of months of this year, and it will get used this year for sure. Now, as you know, we reserve half of the credit for targeted groups until Q4. And so there's part of that credit that will remain throughout the year. with the hopes that we can target as much of this at estimated and underrepresented communities. But the governor has to present a balanced budget. And so that factors into a whole host of calculations that are made. We got great news last Friday with the surplus. So that will certainly change the governor's approach on the budget. And we'll see more about that in the coming weeks. We would not hesitate for a moment to ask Medical Alley or any other advocate for the Angel Tax Credit to push for any amount of dollars you think would be useful for the growth of that program. And you're right that I think the most it's ever been funded in 1 year was 15 million. And even that year, all of it was used. So it's a time of momentum. And I think numbers aside, I think just pushing for this benefit as a priority is key. The Angel Tax Credit, and many of you know this, having advocated for it for years, it's not a particularly controversial package. There are certainly those that think it's not needed, but we think the research shows it clearly meets kind of the but-for calculations for economic development. But even things that are less controversial in a sense in this budget are going to have a fight because there's a lot of priorities out there. And what makes the list and what doesn't is going to be the whole negotiation. So we're eager to see the credit continue and would love to see it grow.
Thank you. Bobby, do you have questions coming in, Lily? I can't see you. I'll ask one more. I have one other question because the whole ability to work virtually, work from anywhere you want, there's probably some net inflow and probably some net outflow. How is that looking right now? Do you see is that a risk for Minnesota, a net risk, or is it a net opportunity? You mentioned some of the movement from the coast towards Minnesota, which I agree, right. and we actually see that, and I think that's awesome. Where do you see that?
I think it's maybe too hard to say I've not seen numbers that show the total number of jobs taken outside the state versus inside the state. So this is primarily anecdotal, but I do know in talking to a lot of companies across the state that it has totally shifted how they think about recruitment, and that they are much more willing to look at a candidate outside of Minnesota to work here because they can do so virtually than they ever have before. So it's definitely changing hiring patterns. I don't see that going away in the future. Our hope is that when Minnesota companies are able to do that, it can kind of be that hook. And then over time, perhaps the individual who is working remotely for a Minnesota company might consider moving here as well. One of the things we passed in the last session was a telecommuter forward package that designates certain towns across Minnesota as telecommuter forward, essentially great spots to telecommute from, whether that's due to broadband internet access, co-working spaces, generally thoughtful policies and practices towards telecommuting. And just that designation, that brief stamp or branding has, we think, helped a lot of our greater Minnesota towns put themselves on the map. And that really leads us to the issue of broadband, of course, which is another major priority of ours this coming legislative session. $50 million proposed at this point. Certainly we could do more than that. And a lot of demand for broadband and a lot of new technology out there that's really exciting when you look at SpaceX and some of the low orbital satellites. We've got to finish that job in Minnesota and make this state really continue to be a leader in connectivity.
This is Commissioner Grove. This is Sean Keefe with Ecolab. How are you today?
Hi, Sean. Good to see you.
Yeah, nice to see you. A question that the last 3 years we've seen kind of on the chopping block, this qualified data center kind of tax credit. This has been something that obviously DEED was actually very aggressive and pushed hard in the last administration. We know that it's an incentive for at least for a 15-year run of trying to make sure that not only the offsets of some of these, the building of the data centers, but also some of the hardware and software that's included. And sometimes it even creates a campus environment with other building around it. So have you kind of taken a position or know of this issue, kind of know why we're kind of supporting at least the current tax credit through at least the initial agreement with DEED? I don't know if you talked with the governor about that, but that's something that just wanted to really share. I'm sure some on this phone can amplify that. It's an important tax credit that we account for, and just wanted to get any sense from you kind of where you're at on that specific incentive.
Yeah, thanks, Sean. And it's a good point. It's a fair point. We debated this last legislative session as well. it is obviously writing the tax bill. And so Commissioner Doty is carrying this, even though obviously Deed administers the program. We know there's a lot of demand for it. We know that we think the most generous program in the country for data centers. And part of the reason that we continue to take a look at it as an area we could potentially gain some revenue back on is that it far expanded the sort of initial estimates of how much it would be used, particularly given that software inclusion in the credit. Which turns out to be in today's world a lot more valuable than maybe it was when the law was first created. And so that software component has made it kind of more expensive, I guess, for Minnesota. I hear very much the points on the data center tax credit, and we will have that debate this legislative session. I know that we will. We've heard from Medical Alley and other corporate leaders in the state that they don't approve of shifting it at all. So we'll take that into consideration and have a conversation. Certainly data centers are a really important component of growing a strong tech ecosystem here. But as everyone here also knows, they don't really create the jobs that maybe a stronger startup ecosystem would create. And they certainly aren't the kind of economic drivers that you would get out of the more fast moving, innovative based technology companies that Medical Alley is trying to grow. So we have really focused our efforts on that startup ecosystem as a area to grow. Not that we don't understand how important data centers are, they are. And we're actively looking at a lot of those deals in our pipeline. But this is a debate that we have to have. And I think really great points made by Medical Alleys and others. And we'll, as we navigate the next steps in this budget, we'll keep iterating on our perspectives.
So, hey, Steve, this is Kathy Toon. So I'm the CFO of Odinata Health, which has now been renamed Marani Health. And we just announced a financing recently, last week. And we, the company, a very young seed stage company, we've used all of the programs that exist, I think. So Angel Tax Credit, Launch Minnesota, Angel Loan Program, all of them. And they've been extraordinarily valuable to the company. Everybody knows this, but the Angel Tax Credit Program being consistently funded in the long haul is really important to the ecosystem for sure. I mean, knowing it's going to be there year in, year out, and knowing how it works is critical. One of the things that I wanted to ask you about was the potential for R&D tax credits. We're just finishing up our federal R&D tax credit process right now, and it's quite an important, valuable tool. What's the thought around that in terms of the state programs?
Yeah, it's a great point. And Kathy, and I think that I was just looking at some research the other day coming out of SSTI on kind of R&D investments by state, both in the corporate sector and in the state sector. And there's not enough in Minnesota. I mean, when you look at the trend line in California, Massachusetts going like this, and Minnesota has kind of tapered like this. And as everyone on this call is acutely aware, R&D is what helps new companies begin. It's what help big companies thrive and adapt. Our state has not spent much on R&D from a proactive standpoint, and I think our tax credits are something that we have to examine there. So I think it's worth a discussion. We haven't put forward a major initiative to shift or change those in this cycle. Again, given the prioritization that we feel is necessary, given how many Minnesotans are hurting in our economy right now, again, that focus has been on the uneven effects of COVID, and particularly as it relates to communities of color and on educational institutions. But again, this budget it's the draft one from the governor as required by the legislature, and we're going to have to then have that discussion of other priorities as we go forward. And I think for you all to highlight R&D as an organization is just a critical investment will help because it's all related. The more jobs that your companies can create, the higher our overall economic outlook will look. And so I think it is important. There's no question.
Commissioner Grove, this is Jim Rogers. And first a comment, just want to really thank you for your leadership, particularly through the pandemic. I think as a state, we're very fortunate to have your leadership in the position you were in. So thank you for that.
Thank you.
Question would be, I think there really is an opportunity on the workforce side. It's a strange one because of the ability to work from anywhere. It's been a long-standing issue for us, attracting the right workforce. And, state governments can be very effective in certain things and associations can be very effective in certain things. When you look to us, is there anything in particular that we could be helping you with as we collectively try to solve this problem?
Yeah, thanks, Jim. I appreciate the spirit behind that question and the question itself. I think one of the things I found, and again, coming from the business world myself into a government context, is that we're not particularly good at marketing in state government. We're not particularly good at tuning our own horn. We're not, we just don't have the budgets for it, nor do we just build the skill sets for it in a sense. So I think the more that you can do to put our state on the map globally as the medical technology epicenter of the world, the better off we'll be. And I think, launches like Medical Alley starts, the great marketing work you already do are a start, but I think it's more is what I would say we need. In the more near term, anything you all can do and continue to do to advocate for Launch Minnesota, the Angel Tax Credit, our broadband initiatives, any component of this budget you think Medical Alley can get behind would be helpful. One other I'll mention, just Jim, because you raised the issue of workforce, we've taken a long and studied look over the last year at the state's Workforce Development Fund, which is a fund that every single employer in the state pays into through a very small payroll tax, but that ends up with $120 million that DEED then administers to grow and build talent in Minnesota. It is a fund that has not really been meaningfully reformed since it was launched in the mid-'80s. And my gosh, the economy has changed rapidly and massively since the mid-'80s. So we have taken a huge deep dive into how to reform that fund to better serve the workforce of today. That reform effort has prized innovation as a major focus. It has prized equity as a major focus. It has prized focusing on performance as a major focus. And we need these changes to take place so that government can better create pipelines into companies in all sectors in our state more effectively than we do today. So if you, as an organization, could get behind those Workforce Development Fund reforms, it would make a big difference. They're not hugely controversial, but they're in no way inevitable to change because there are certainly a lot of perspectives on it. And so we'd ask Medical Alley to take a look at that as well as maybe something you could support this session, because we think it's that kind of structural change that can really shift the trajectory of what we're doing in the state. That's
tremendous. Thank you so much for that input.
Thank you very much. We are unfortunately running out of time. We could continue this conversation for a long time. First, thank you very much for participating and being here, being a partner of the Medical Alley Association. We are a resource and always ready to engage. I'll finish with a short thank you actually from one of the participants, Emily Piper, that in the chat box says, not a question, but a comment. Really grateful to you and the DEED for your work in administering and providing technical assistance on the unemployment insurance during the pandemic. Thank you very much for that. So on behalf of all of us, thanks for your time. Really appreciate it.
Absolutely. Thanks, Stephan. Thanks, everybody. Have a good day.
Thank you too. Now I would like to introduce our next speaker. And I just need to see that Commissioner, yep, there you are. I'd like to introduce our next speaker, Commissioner Alice Roberts-Davies from the Minnesota Department of Administration. She has also been a very strong partner with the Medical Alley community throughout the pandemic. One of the less visible effects of the COVID-19 pandemic has been the serious supply chain disruption. We've heard about it, but it has been quite significant. And when COVID hit, Governor Walz put Commissioner Roberts-Davies in charge of a multi-agency critical care supplies working group, a daunting task given the uncertainty of the pandemic. Commissioner Alice Roberts-Davies serves as Commissioner of the Minnesota Department of Administration. As Commissioner, Alice leads a dozen of administrative service divisions, including the state's purchasing, real estate property, fleet, risk management, demographic analysis, and continuous improvement services. In the early days of the pandemic, Medical Alley Association worked with the Walz administration to offer support. We established the Medical Alley Support Supply Chain Group, composed of experts from our membership, working closely with the Critical Care Supplies Working Group to help the state in procuring necessary supplies. It's an honor to have Commissioner Roberts-Davies join us today to offer remarks on the partnership between the state of Minnesota and members of the Medical Alley community. Please join me in welcoming Minnesota's Commissioner of Administration, Alice Roberts-Davies, and know that the Q&A remains open and also the chat. Over to you. Thank you so much for being here.
Thank you, Stephan. Good morning, everyone. Thank you so much for the invitation to be here. It's really great to be here with the membership of Medical Alley and, of course, my friend and colleague, Commissioner Grove. First, I want to thank you all for the work that you do and for doing it here in the great state of Minnesota. It's really an honor to know that I'm speaking to the future of healthcare. You embody Minnesota's tradition of pioneering breakthroughs and innovation in healthcare. As you know, in this last year, we saw how a pandemic can emerge so quickly and turn a society completely upside down. An effective response required an all hands on deck approach, one that includes government, the private sector, research institutions, and frontline workers to cooperate and share expertise and intellectual resources to wage a fight of this magnitude. And Medical Alley and your individual members did just that. And in fact, as you heard, you were the first to step up and partner with the state to make Minnesotans safer, and we're so grateful that you did. As you know, we've seen horrific numbers of illnesses and deaths in the last year, but we also know how much worse it could have been without this incredible collaboration. As the COVID-19 pandemic spread across the globe, Minnesota's healthcare professionals have been competing with every other state and nearly every other nation for personal protective equipment. Governor Walz directed us, the state agencies, to leverage every possible resource to ensure that the state, on behalf of its healthcare workers, had the PPE and medical care supplies needed to save as many lives as possible. So in March of last year, the governor established the Critical Care Supplies Work Group to source the PPE needed for frontline healthcare workers. The Critical Care Supplies Work Group was an interagency team of state procurement professionals, a project manager, a data scientist, and a group of National Guard members to do the logistics of this work. Now, I'm here selfishly to thank you personally because I was named, as Stephan said, to lead that in addition to my job as the Commissioner of Administration. I mentioned how this was an interagency team, but it was actually 3 people sitting in a room together for many, many, many hours, relying on a small team of National Guardsmen at a warehouse, and also relying on you, the team at Medical Alley, and others. What really made it successful was that we have a rich and philanthropic corporate community here in the state of Minnesota, and you were willing, you saw the need, and you came to us. You spared no resources, and you connected us with your suppliers, leveraged your international presence to vet foreign vendors and verify quality. You assisted us in following up on leads and helped us arrange international transportation of goods, helped us develop automated inventory systems, and much of this was developed through the business community's liaison with my team. And this was a 24-hour operation for many, many, many months. Many companies that are part of Medical Alley supply chain group, including Mayo Clinic and of course 3M, were led by Ecolab's Executive Vice President Jill Wyant, and Jill was a tremendous partner to us. So as you can imagine, one of our first initial actions was to establish a state warehouse to store and distribute goods. And these goods were always intended as a safety net for hospital PPE in the event that they could not source their own and keep up with pandemic response needs. And when you think back to March of 2020, that's exactly what we were seeing. Hospitals didn't have ventilators or N95 respirators or gowns. And we were at that point in time even purchasing raincoats for gown substitutes and hoping that we never actually needed to use those. And today hospitals are still responsible for purchasing their own PPE, but in the event that they reach critical inventory levels, they're able to source from the state anything that they need to supplement what is already in their supply chains. But the work has been so successful because in the very beginning, if they were at a crisis inventory level, meaning they had only 0 to 3 days of inventory in the hospital system, they came to the state. Now we're at a point where they can be at a critical level of 4 to 7 days of inventory and come to the state. And we're now moving back more to a run state, which is that they're in less of a conservation mode and more of a normal usage rate before they come to the state. And so things are more normal and more of a run state than they were previously. I think that someone from Medical Alley is going to help me with some slides. I just wanted to share with you the next slide, which shows a little bit more of where we are with inventory at the state. And our goal at this point in time is to keep in the warehouse at the state at least 30 days of inventory. The blue that you see for each of the 5 critical categories, which are face masks, face shields, gloves, gowns, and N95 respirators. The blue is what's in the hospital system. The gray is what's in our warehouse, which we would like to keep at 30 days. And we have currently more than 30 days of each of those critical care supplies. And then the red is what's on order en route to the warehouse. And so we're very happy with what we've been able to achieve, of course, with your assistance. The next slide gives just a little bit of a different look at that. It talks more about what we were able to procure versus what was given to us by the federal government through their strategic national stockpile, and then also donations that we received from other partners across the state and the world. So I just thought that that would be helpful for you as a frame of reference to see that we went from a bare bones warehouse to having expanded the warehouse 4 times and acquired a second building that is now also full of personal protective equipment at a time where there was very scarce supplies across the entire globe. So this partnership has worked tremendously. It's been an absolutely phenomenal collaboration. Just pointing out that at some point in time, each one of those critical care supplies was absolutely impossible to source. We haven't had any one of them that was ever in easy ability to source. We've always had a problem with at least one of them, but always been able to keep our inventories in stock on all of them. So part of sourcing scarce personal protective equipment is an intensely competitive environment, ensuring authenticity and effectiveness before delivery to healthcare facilities. And our top priority has been protecting the safety of our healthcare workers. So our group has worked closely with the University of Minnesota, especially with N95 respirators. Anything that we have received as a sample has gone to the University of Minnesota for fit infiltration testing so that we can ensure that anything that we have purchased is authentic and we're not risking any healthcare professionals' health by sending them an inferior product. Through our extensive system of checks, we have prevented a lot of inferior product from entering the state. And an example of that made local and national news in December when we enlisted 3M's assistance in removing 500,000 counterfeit N95 respirators from circulation. We are so fortunate to have this great company right here in our backyard. We called them up, they came to our warehouse, and upon inspection, they knew right away that we had a counterfeit product in our warehouse. And fortunately, because of our negotiations, no taxpayer dollars were lost on that transaction. So we were very proud of that fact as well. So as you know, it has been a long year. It's been a hard year. It's been a year like we've never seen before that called for a lot of play calling from the gut because there was no playbook. But my team has worked nonstop over the last year in securing the necessary PPE to meet several surges and overcome tremendous commodity shortages. And I am so proud of their commitment. And I thank all of you for your partnership in helping us do this vital work. It has been invaluable. And so thank you, thank you, thank you. And I'm happy to answer any questions you may have.
Fantastic. Thank you very much for your comments, and also thank you very much for your leadership. Impressive work, really impressive work. We have the floor is open for questions, and I'll ask the first one. It actually builds on your comments on the partnership, private-public partnership, and that has worked really well during the past year. How do we as a community, how do we learn from that? How do we continue to develop that? How do we continue to build that out?
I think that's a great question. I think that there has been, frankly, almost an inherent tension in the past between public-private operations, and there's always a somewhat of a hesitancy to invite the private sector in when we're doing some public work. And I think that we have to abandon that. We have to look to the private sector as partners in this work going forward, because I think that this is a great example of how we can leverage your resources and ensure that we are looking at this holistically, and obviously looking at, especially in this international marketplace that we were working in, there were tons of resources that would have never been made available to the state without a public partnership, including having people who were available to go directly to factories to ensure that factories were running, to ensure that product was actually being manufactured there, giving us the lay of the land in foreign countries and vetting vendors for us. So I think that we have to be much more reliant on all of the resources that we have here, because again, we have a very rich corporate partnership or corporate community that can really help us leverage the state of Minnesota's resources. We should do a better job.
Thank you. Sean? Yeah.
Yeah, Commissioner, thank you. And Ecolab's really been, Jill's been such a rock star, and so we're proud however we can do to continue to be supportive for you and the agency. But the question really is just around the vaccination, and how can we, Medical Alley and Ecolab and others be helpful as with, because that's the next kind of real push. I know you brought that up initially, and then also just for your own workforce, how are you dealing with, having remote folks? I'd love to hear it. We all struggle on our side, but how have you been doing as the head of an agency to, just manage, make sure things still have to be done, right? So just be curious on that aspect as well.
I will start with the second question first. I think engagement for our agency has been really a challenge. We've done a lot around agency engagement. We were actually on a really great path with agency engagement before the pandemic struck, with ensuring that this was a great place to work. We want state government to be an employer of choice, of course, but then within state government, we wanted the Department of Administration to be the agency of choice as well. And so we were doing a lot of work around that, and that's been difficult because we were moving in a great direction with that. But now that people are working remotely, how do we allow them to continue to feel engaged? I feel really responsible for new team members who we've brought on board, and how do we continue to make them feel a part of the team? People who are nearing retirement age, how do we keep them engaged as well? How do we recruit new team members? I think all of those things are going to be critically important for us, because we do have a large number of people who are ready to retire, and it'll be difficult for us to recruit new people. And also getting people back to the workplace when the time comes is going to be extremely difficult, because obviously this is attractive for a lot of people. And so we've been doing a lot around how do we make this transition back to the workplace effective? How do we make it a place where people are excited to come back? And is there some hybrid way that we bring people back that makes it a good place for everyone? Because I think that the private sector will probably be even more appealing going forward if they do it differently. So I think that that's really important. As far as vaccine rollout goes, I think that there are probably lots of ideas that can be shared between the private sector and the state on how that works. The great news is that things are going very well. I think that we're probably ahead of schedule already on how vaccinations are rolling out. I hear that we're getting very close to the 70% already on the 65 and older. And so that's exciting news. And I think that there's probably opportunities for us to do it even better.
Thank you.
Looking around my screen here. Jim, yeah.
Yeah, I just think more a comment. Just again, Commissioner, wanted to say thank you. I know that there was no playbook for any of this. And as you said, a lot of gut calls had to be made. But the willingness to work in partnership, I think, is a testament to what you have to do in those types of situations. And the results were, that they speak for themselves. So I want to say thank you for your leadership. It's never easy. And no matter what call you're making, you're going to have people, kind of asking questions on both sides. But thank you for doing the right thing and keeping your eye on the ball.
Thank you.
All right. I think we are getting to time. Thank you so much for joining us. We really appreciate it. Thank you for the comments, and know that the Medical Alley Association is a resource, and always willing and able to engage in working with you. So again, thank you very much.
Thank you. Enjoy your rest of the day at the Capitol.
Thanks. We'd like to thank both commissioners for joining us. We have really strong leadership, and we appreciate the support to the community. And we're looking forward to working with them as we continue to elevate Medical Alley as the global epicenter of health innovation and care. And I think the conversations we had illustrates quite well how that will work going forward. We have learned this year that it is essential to have strong public and private partnership with the state, and we look forward to continuing to grow these relationships over the coming years. Beyond the unique challenges of our community over the last year, we all know that we have reached a significant inflection point that is redefining healthcare for millions of Americans and patients around the world. Our community is equipped with the knowledge and expertise to lead this conversation. We can set the definitions for value and outcomes. We can showcase how healthcare can work right here in Medical Alley. To do so, it is imperative that we work with policymakers to address 4 key issues. And I'll just briefly outline the 4 issues for you. Number 1 is talent attraction and retention. Minnesota must significantly increase its attraction of talented people and better prepare its existing workforce to keep driving healthcare forward in a positive and impactful way. While Medical Alley Association has created our own talent attraction and development initiative to address these needs, we need help from the state to enact policies geared toward workforce attraction, retention, and preparedness. Point number 2, foster an innovative ecosystem. To maintain leadership, Minnesota must continue to foster an environment for innovators. This requires a renewed commitment to supporting entrepreneurs and incubators, ensuring that our state has the necessary tools to capture and retain the growth of organizations that drive our innovation economy. We support policies and programs that make Minnesota a friendly and competitive place to do business. Number 3, healthcare transformation. Our country is facing significant challenges in healthcare, and to solve them, we must listen, lead, and innovate. Our association is focused on supporting policies that drive healthcare transformation, the result of which is increased access, improved outcome, and lower cost. We eagerly offer our unique, industry-diverse, cross-sector membership as a resource for legislators as they craft successful policy solutions. And number 4, addressing growing health disparities. Disparities in access to care and health outcomes for underserved rural and minority populations has long been a significant issue in healthcare, but has been exacerbated by the pandemic. And we ask that legislators continue to closely examine these issues and identify policies and partnership that can help eliminate these disparities. Thank you to all the members for being part of this amazing community. Thank you for your engagement to further demonstrate what it means to be the global epicenter of health innovation and care. The work being done in Medical Alley impacts us all. Together, along with Governor Walz, his administration, and the Minnesota House and Senate, we can work together to assure that Medical Alley continues to be on the forefront of health innovation and care. And again, thank you very much all for being here. Really appreciate it.